Hello, everybody. My name is Manish Tiwari, and I'm a PGY4 resident at The Ohio State University, and I'm the incumbent president of the Physiatrist in Training Board. We welcome you to our first Q&A interview with Dr. Flanagan. Dr. Flanagan is the president of the AAPM&R, as well as the chair of rehabilitation medicine at New York University's Grossman School of Medicine. And he is the medical director of Rusk Rehabilitation at NYU Langone Health. Today, we're going to be chatting with Dr. Flanagan about PM&R Bold and what AAPM&R is doing to lead the specialty towards success. Dr. Flanagan, we're excited to welcome you as AAPM&R's 2022-2023 president. Can you share a bit about your background and what your current practice is?
Well, thank you so much, Manish. I appreciate that introduction, and thanks so much for chatting with me today. So my practice has been brain injury medicine for the about 3 decades that I've been practicing, actually exactly 3 decades. I started off at Mount Sinai in New York City, rose to the rank of vice chair, and then ultimately was recruited to be the chair at NYU School of Medicine, now NYU Grossman School of Medicine. So my practice, clinical practice, is still brain injury medicine. I spend about 30% of my time doing that. The bulk of what I do now, as you can well imagine, is administrative. Predominantly in the department, but now a fair amount of time for the academy as well, now that I'm president. And I still do some teaching, which is one of the greatest joys I have, is being a physician in academia, and a little bit of research still. So that's what I do. That's my background, and I'm really excited to be part of this exciting time with the AAPM&R in advancing PM&R Bold and advancing our specialty.
Wonderful. Well, we're very lucky to have you. In your first editorial in The Physiatrist, you share your commitment to advance the PM&R Bold initiative. Can you explain more about the Academy's PM&R Bold journey and what PM&R Bold means to you?
Yeah, so that is a great question. So PM&R Bold has been around for about 6 or 7 years, and I'm going to start off by saying that it's not a sort of a cliche or a sort of a snappy phrase. I mean, this is really the vision of the academy for our specialty going forward. When I first joined the Board of Governors, which is about 6 or 7 years ago, that is about the time when we started to think about where our specialty needed to be going forward. Healthcare has been in flux for the entire time I've been in medicine. And then we realized back in around 2016, 2017, that the academy, as the medical society, the primary medical society for physiatrists, it was our responsibility to ensure that we, as a specialty, as physiatrists, didn't just survive all of these crazy changes that we're still dealing with today, but really to thrive, and to thrive not just for ourselves and not to do it for the academy's sake, but for our members, for physiatrists, and equally important for our patients, because what we do in medicine is so important. We also recognize that we didn't have all the answers, so we went literally across the country, bringing together physiatrists in major metropolitan centers, getting their opinions, their thoughts. Where do you think we need to be? How do we position ourselves going forward to ensure that we really thrive going forward, ensuring that we continue to make sure our patients who need physiatric care have better experiences, have better outcomes, and oh, by the way, making sure that we do it in an efficient manner. Inefficiency is just a euphemism for less money, and that's where the government is going. So we gathered all of this information. We brought focus groups together at our annual assembly, and getting all that information together and having lots and lots of meetings and consultants and bringing all of our members together, we ultimately developed 5 practice areas that encompass a lot of what we do, much of what we do in physical medicine and rehabilitation, and developed envisioned futures for those areas. We got co-chairs for each one of these envisioned areas, and those envisioned areas are pediatric rehabilitation, musculoskeletal care, the rehabilitation continuum of care, oncological rehabilitation, and most recently, spine and pain care. In each one of those practice areas, with the co-chairs and the Board of Governors, in particular, our staff liaisons and the president-elect of the Academy help to develop these envisioned futures. And these envisioned futures are what we believe we should be, what we should be offering medicine going forward in these areas. And in those envisioned areas now are being developed. We're recognizing that since we have this future that we see ourselves in, what are the barriers that we need to overcome to ensure that that happens, and the Academy is moving forward with that with full force. That's PM&R Bold, making sure that our C-suites at all the different healthcare systems, payers, our referral sources, patients understand that if you really want to achieve fully that triple aim of medicine, you need rehabilitation. You need us to realize these envisioned futures. Otherwise, the triple aim of medicine, the triple aim of healthcare, is not going to realize its full potential. That's PM&R Bold.
Well, that's a very comprehensive response, and I can tell your passion just from sitting here about this matter. To follow up on that, can you explain more about the tangible efforts that the Academy is leading to position PM&R and individual PM&R physicians to thrive in the evolving healthcare environment?
Right. So it's basically everything that I just said, right? So, so in addition to developing those envisioned futures, we've asked all of these practice areas to develop core curriculums. What is it in that particular area of PM&R every physiatrist ought to know, and what is it that specialists need to know? We're addressing some of the challenges that we understand exist in realizing those futures. For example, there's a workforce issue. There are about 12,000 or so board certified physiatrists in the country. Man, there are just so many more people who need our services than there are physiatrists to help. So what are we doing about those workforce issues? And we're addressing those head on. We're also increasing awareness of the value that physiatry brings. And we need to do that in a number of different ways. So we're moving forward with our registry efforts, getting data, ultimately big data, to support the value that we bring to right now those two areas in our registry, ischemic stroke and low back pain, but eventually more. We are developing guidance, for instance, in our PASC initiative, post-acute sequelae of COVID, bringing together physiatrists, leading this effort among our colleagues in other areas to advance knowledge of PASC. And that's an Academy effort. That just recognizes or elevates the value or the realization of our value to other specialists. We're working hard to support our members in reimbursement, issues like that. We're defining the role of physiatrists to enhance care in subacute rehab, knowing that that's where a lot of our patients are going. We're supporting the role of physiatrists in IRFs and in what a director of an IRF should be, and we believe that should be a physiatrist. So we're advancing all of these issues very actively in many different venues to support that entire bold effort.
Wow. Yeah, thank you. It sounds like the Academy is doing a ton to support both individual physiatrists and to ensure the success of our specialty. My last question for you is, why do you encourage members to become involved in the Academy?
So, that is a great question. One of the challenges of physiatry is that we are so diverse, and diversity is good, right? But I'm a brain injury specialist. There are spinal cord injury specialists. There are spine specialists. There are geriatric specialists. There are oncological rehab specialists. And that list goes on, and there's so many more of what we do. So, it's easy for us sometimes to identify with other groups. Being members of other organizations, other societies, perfectly fine. But at the end of the day, there is no society that is made of physiatrists for physiatrists, and that's the Academy. And nobody's going to stick up and support the work that we do as physiatrists, the specialists in function, the specialists who really take care of folks with disability than an organization like the American Academy of Physical Medicine and Rehab. And what we're doing with the BOLD effort is not to advance the academy, it's to advance our field, to advance our members, physiatrists who are out there practicing, because we all know that you add so much value to medicine. And for medicine to really realize that triple aim, you need us. But we need you, physiatrists who are out in practice, to help us realize that vision. We need you to be the champions, to espouse the value of what we do to the C-suite, to the payers, to the primary care docs, who quite frankly really don't want to treat back pain and stroke and all that. They want to send them to us so we can help out. So we need those members to support us, in turn to support them. The Academy is a physiatric run organization for physiatrists. That's why you should be a member.
Well, Dr. Flanagan, thank you for answering all of our questions. I think that the Academy is in great hands under your leadership.
Well, thank you so much, Manish. I appreciate that. And quite frankly, I think the future of our field in the Academy is in great hands because we have future leaders like you. Thanks so much for asking these questions. I really enjoyed it.